We'll start the 2003 pharmacy MCQ paper. I will do all the papers up to 2020. Day by day, I will add more and more videos. It will be systematically after 2003. It will be 2004 and so on. We'll come to about 2020. Okay. So and also you will see the same questions are coming again and again. So once you do this, at least 50% of your next exam questions are here. Okay, we'll go to the question number 1 in 2003 paper. True or false of drugs used in angina. So sublingual glyceride trinitrate known to cause postural hypotension. Postural hypotension is when the patient is standing in standing position. They can faint because not enough blood going to the brain. They can fall down. Reason is glyceride trinitrate has quick action and it will dilate the blood vessels in your body, that is in the legs, and also less blood is going to the brain now when the patient is standing. So that is the blood pressure will go down because the now blood vessels are larger, bigger in size. So pressure is down. That is called postural hypotension. So this is about glyceride trinitrate. Why it is given? Is given when a patient has a chest pain, they have to take glyceride trinitrate if they are anginal patients. Very given for anginal pain. So anginal pain is the blood vessels are blocked with something like cholesterol or atherosclerosis or something like that. Tablet and spray formulations are there. It is very quick action and it is finished also quickly. Very short acting. Rapid relief to the pain. Patient has to sit down when they take this tablet because of postural hypotension. They can also be used before exercise. Some people, if they know that they have anginal pain when they are doing some heavy work, so they can take the tablet just before, say if they have to climb up to 10th floor walking, so then they better take the GTN tablet, keep under the tongue and then go. So he is safe. Otherwise, after some little bit of time, they feel chest pain and trouble. Other formulations contain GTN, skin patches. Skin patches, ointment, they are long acting. Transdermal nitrates are given to prevent anginal pain. Patient should have a nitrate-free period within a day. This is very important. Patient should not, now even anginal pain patients, they cannot take the whole day this tablet, GTN tablets, because anginal pain will not respond to GTN tablets when they take it frequently. So they should have a nitrate-free, GTN-free 12 hours, a half day without anything. So in the night time, normally they don't get pain. And also even the patch, GTN patch, that is called transdermal nitrates. The patch they have to remove for 12 hours and then keep for 12 hours. So, because the sensitivity to the drug will be disappear. That means the patient become tolerant. That is called tolerance. Patient can develop tolerance. Tolerate. So tolerate the drug. Patient get used to the drug. Tablets, if they are taking one tablet under the tongue as soon as possible. Immediately after getting the chest pain, patients should sit down. After 5 minutes, if the chest pain is still there, take the second tablet. If the patient feels pain, still pain, then now after 10 minutes, that means after 5 minutes after the second dose, දෙවෙනි dose එක අරන් විනාඩි 5කට පස්සේ third එක ගන්න පුළුවන්. ඒක final. එතනින් එහාට ගන්න බෑ. Spray ගන්න පුළුවන්. Spray 1 or 2 sprays under the tongue. Still pain, 5 minutes, same thing applies. So, same thing as tablets, spray also. 5-minute period, first dose, then 5 minutes, then after another 5 minutes. That is all. Patient has to get admitted to the hospital. GTN tablets, every 8 weeks, they have to remove the existing bottle. They can't, after opening the bottle, they can't keep it for more than 8 weeks. සති 8කට පස්සේ අයින් කරන්න ඕනේ. අයින් කරනවා කියන්නේ මොකක්ද කරන්නේ? ෆාමසියට ගිහින් දෙන්න ඕනේ. ආයෙ විකුණන්න ගිහින් දෙනව නෙවෙයි, ඩිස්කාඩ් කරන්න ගිහින් දෙන්න. පේෂන්ට්ලා විසි කරන්න බෑ ඩ්‍රග් එක කොහට හරි. So side effects දැනගන්න ඕනේ. You have to know the side effects: headache, flushing, that is redness of the skin, dizziness, fainting, nausea, vomiting. You can get all this. Oral isosabide dinitrate is recommended for relief of an acute attack of angina. In acute attack, you can't use isosabide dinitrate or isosabide mononitrate because that drug has to go to the stomach and absorb to the body. So only GTN, sublingual tablet, is used in the emergency tablet or spray. GTN tablet or GTN spray are the two drugs can be used in anginal attack. Isosabide dinitrate, that is used to prevent anginal attack, not used in an emergency. Okay. We'll go to C. Atenolol acts by reducing cardiac workload. That is true. Because the cardiac beta 2 receptors are, beta 1 receptors are blocked. So less stimulation to the heart muscles to pump blood. So less work to the heart muscles. So reducing cardiac workload. So cardiac stimulation is by epinephrine and norepinephrine. So the same thing is called adrenaline and noradrenaline. In USA, it is called epinephrine and norepinephrine. In Britain, it is adrenaline and noradrenaline. Go to D. Verapamil is known to cause bradycardia. That is true. Verapamil and diltiazem work on heart. Verapamil has a lot of side effects, and it reduces the heart rate, bradycardia, and most of the patients go to heart arrest level. So much reduction of blood pressure. So side effects include dizziness, slow heartbeat, that is bradycardia, constipation. It's a very common non-constipation with verapamil, then nausea, headache, vomiting, tiredness, all these are there. Verapamil is not a good drug to give because it causes a lot of complications. E-glyceride trinitrate belong to the beta blocker family, that is false. It is nitrate family, vasodilator. It is nitrate family. Yeah. Question number 2. True or false of drugs used in hypertension? A. Thiazide diuretics are used in low doses for management of hypertension. Thiazide diuretics are used in low doses for management of hypertension. 2. Thiazide diuretics are used as 25 or 50, not high doses, to reduce blood pressure. Even if you increase the dose, the action will not be increased. Drug එක 50 දුන්නත් එකයි 150 දුන්නත් එකයි action. Thiazide diuretics can lower potassium and magnesium blood levels. They are eliminated in urine, but calcium is retained in blood. When you study diuretics, you will learn furosemide lost everything. Everything means sodium, potassium, calcium, all. But in the case of thiazide diuretic දෙනකොට potassium loss hari, sodium loss hari, but retain calcium. Calcium loss වෙන්නේ නැහැ. Calcium ඉතුරු වෙනවා යන්න නොදී. ඉතින් calcium අඩු osteoporosis patient කෙනෙක් මම ළඟ දැක්ක දීලා තිබුණා. ඒ patient hypertension නැහැ, ඒ උනාට thiazide diuretic දීලා තිබුණා. CTP ගන්න. Reason එක calcium retain වෙනවා. එංගි calcium අඩු වෙනවා. Osteoporosis වලදී calcium නවත්ත ගන්න එක තමයි වැදගත් body එකෙන් අයින් වෙන එක. So low levels of potassium and magnesium in blood can result in thiazide විතරක් නෙමෙයි furosemide වලටත් වෙනවා. Abnormal heart rhythm, particularly in those who are taking digoxin. Potassium අඩු වුණාම heart rhythm එක වෙනස් වෙනවා. Thiazide diuretics can increase the risk of lithium toxicity. Lithium අයින් වෙනවා අඩු වෙනවා. Kidney side. Lithium narrow spectrum antipsychotic එකක්. ඉතින් lithium release වෙනවා අඩු වෙනවා. thiazide diuretic වලට toxicity වලට යන්න පුළුවන්. NSAID thiazide diuretics වල effect එක අඩු කරනවා. Kidney function එක reduce ආයත දෙන්නේ නැහැ thiazide diuretics. furosemide දෙන්න පුළුවන් kidney function අඩු නම් diuretics වල furosemide දෙන්න පුළුවන්, not thiazide diuretics. Furosemide is allowed to give. Thiazide diuretics alter carbohydrate metabolism. So diabetic patients are not given thiazide diuretics because they will have increased blood sugar levels. B. Hydralazine is a vasodilator drug. Hydralazine is a vasodilator drug. True. Prozosine is an alpha blocker. That is also true. Prozosine blood pressure වලට දෙනවා. මේ receptors අපි beta කතා කරාට මෙතන alpha තියෙනවා. Patients have alpha 1, alpha 2 also like beta 1, beta 2. Alpha 1 was smooth muscle contraction, vasoconstriction. Then alpha 1 are mostly in blood vessels. Now, beta 1 in the heart, beta 2 in the lungs receptors. The alpha 1 receptors are in blood vessels. So when stimulated alpha 1 receptors, vasoconstriction is the result. Vasoconstriction, secretion අඩු gut relax gut movement එක අඩු heart එක arrhythmias pupillary dilatation. Alpha 2 different neurotransmitters release කරන එක අඩු කරනවා. ඒ vasoconstriction same. Decreased sympathetic flow, that is adrenaline and noradrenaline action එක අඩු කරනවා. Decrease insulin release and platelet aggregation. Classification. දැන් මේ drugs දෙනවනේ මේවට. Processing අහන්නේ මේක තමයි. This is alpha 1 receptor blocker processing. Others also. Normally they ask this. And for selective alpha 2, yohimbine. Yohimbine තමයි අහන question. D. Atenolol is not recommended for management of patients having high blood pressure and bronchial asthma. Atenolol is not recommended for management of patients having high blood pressure and bronchial asthma. True. High blood pressure atenolol can be given, but not when they have bronchial asthma. Blood pressure වලට දෙන්න පුළුවන්, bronchial asthma තියෙනකොට දෙන්න බෑ. කලින් එකේ කිව්වා. 2002 paper එකේදී explain කරලා ඇති. Digoxin has antihypertensive properties. True. So digoxin in the night time reduce the blood pressure. Digoxin heart muscles වල පොම්ප කරන එක හොඳට කරනවා. heart failure වලදී heart එක පොඩ්ඩක් නම්බු කරනවා. Original foxglove known as Digitalis purpura. Digitalis digoxin is a plant product. 3. True or false on angiotensin converting enzyme inhibitors. Dry cough is known as side effects. Angiotensin converting enzyme inhibitors, ARB, ACE inhibitors cause dry cough. Then you can talk about the ACE inhibitors are within the angiotensin mechanism is controlling our blood pressure. So liver is involved and kidney is involved and lungs involved. When kidney feels the lower blood pressure, then what happens is kidney release renin. Kidney has a place called juxtaglomerular apparatus. So that is touching the blood flow. So that will that is some type of cells that will feel low blood pressure, then release renin. Renin is an enzyme, proteolytic enzyme. So liver release angiotensinogen. Angiotensinogen. This has no action, but renin can convert this to angiotensin 1. That is angiotensin 1. Angiotensin 1 is converted to angiotensin 2. Angiotensin 1 is converted to angiotensin 2 by lungs release ACE. Angiotensin converting enzyme comes and do this part. So angiotensin 2 is the active compound. Angiotensin 2 has is in the previous one. Just have a look. Yeah, it will explain you what angiotensin 2 does for us. So this enzyme inhibitors, like if this enzyme is inhibited, angiotensin 2 production is low, so then blood pressure will be down. So the question is, it causes dry cough. That is true. That is enalapril, captopril cause dry cough. If a patient complains of dry cough, then what is the next drug? The ARB, angiotensin receptor blocker. This angiotensin 2 go to angiotensin receptors and block it. Angiotensin, those drugs are ACE inhibitor, sorry, ARBs, angiotensin receptor blockers, losartan, valsartan, and all SARTN group. So this doesn't cause cough. If the patient complains cough, when chronic cough, when they start enalapril or captopril, then the doctors normally change it to ARB. Loperamide belongs to this group. It's about this is false. Loperamide slow down the intestinal motility. That is, inhibit the peristaltic activity. It is a non-selective calcium channel blocker. So it cannot be given for blood pressure because it is working all over the body. See, they are contraindicated during pregnancy. That is true. ARBs or ACE inhibitors, they can't give during pregnancy. D, hypokalemia is a known side effects. That is false. These two drugs cause hyperkalemia, that is increase serum potassium, blood potassium levels. So when the patients are given these drugs, especially in fairly high doses, they have to always check the potassium levels in the blood. They should not be given to diabetics. That is false. These are the two drugs selected for diabetic patients because they are called nephroprotective. That is, it protects the kidney. So these are the drugs given for diabetic patients when they develop blood pressure. So we go to number 4. True or false? Drugs used in heart failure. Losartan is a calcium channel blocker. That is false. We all know that. Intravenous furosemide is known to cause hypokalemia. That is true. Fusimide cause loss of potassium, sodium, calcium, magnesium, all. That is called loss of potassium is called hypokalemia. Hyponatremia is loss of sodium. Hypomagnesemia is loss of magnesium. Hypouricemia means, hyper uric acid accumulated. Hyperuricemia. If a patient takes fusimide for a long time, they will develop gout arthritis because of hyperuricemia. Digoxin decreases contractility of heart muscles. Digoxin decreases contractility of heart muscles, that is force, it increases increase the force of contraction, but not the rate of contraction. Heart rate is not affected, but contractility is increased. During the night time, digoxin reduces the heart blood pressure. So see, the half-life is 36 to 40 hours, very long. So when you give the drug to the patient will have in the body for a very long time. So therefore, frequent checking the blood for digoxin level is very important. This is digoxin. Now you may face some question. Digoxin is a steroid. That is true. Digoxin has lactone group and it has a sugar group. So this part is called aglycone. So captopril is effective in chronic heart failure. That is true. Only thing, remember, you can't give calcium channel blockers in heart failure. Spironolactone is not effective in reducing the edema seen in chronic heart failure. That is false. Spironolactone is given in heart failure. True or false? Simvastatin is a lipid lowering drug. It is true. Simvastatin reduce the blood cholesterol. See the side effects. You can get muscle aches. Long time use, you can get diabetic. So you can get muscle weakness. Heparin is an oral anticoagulant. Heparin is not an oral anticoagulant. It has to be taken intramuscular or intramuscular. Sometimes they give in as infusion, slowly. So this is the structure of heparin. When you see, you will see a glucose structure, a sugar structure, but it has some sulfate groups, but generally a sugar structure. So because of that, even starch is sugar structure. You don't need to keep it in the fridge. Storage of heparin, you need not use a fridge. So heparin is a mixture of sulfated mucopolysaccharides. It inhibits antithrombin 3 It is in the 2002 paper also. It inhibit action of antithrombin. Sorry, it increase action of antithrombin 3 by 1000-fold, prevent blood clotting, anticoagulant. The test you do to check the heparin effect is APTT. That is activated partial thromboplastin time, APTT. Bleeding is common among elderly people and people with renal impairment. Long-term therapy post osteoporosis and heparin thrombocytopenia. So, three main problems when you get heparin. Bleeding, very common. You have to be very careful when you give bleeding. Recently, in Jayawardhanapur Hospital, one patient was given warfarin overdose, very high overdose. For the same patient, they have given heparin also. The patient died within hours. So that is what they do in hospitals. So first thing, the problem is bleeding. The second one is when if they take for a long time, can cause osteoporosis, and then thrombocytopenia. Thrombocytopenia is reduction of platelet count. Platelet count එක වහිනවා. අඩු වෙනවා. Administration, heparin always given as infusion or injection. So there is unfractionated, sorry, heparin is unfractionated. That means whole molecule is given. But there is another preparation. Part of the heparin molecule is given as enoxaparin. Enoxaparin is fractionated heparin and it is given by subcutaneous route, 30 milligram twice a day or 40 milligram once a day. This is the dose. So this is not like heparin. Enoxaparin is given so enoxaparin is given subcutaneous, remember that, and it is not given in other routes. Heparin is given not in milligrams, it is in units. Heparin is given calculated as units. C. Aspirin is used in high doses for antiplatelet action. That is false because aspirin is used for, that is right, but it is in low doses. Warfarin is known to interact with several drugs. A huge number of drugs are to react with warfarin. So when you give warfarin, you have to be very careful because other drugs are affecting it. That is called drug interaction. For example, if you take erythromycin and clarithromycin, the metabolism of warfarin will be very much reduced. Heparin metabolize then build up in the body, heparin level, warfarin level. Then warfarin toxicity means bleeding. Streptokinase is an anti-arrhythmic drug, that is false. Streptokinase given for fibrinolytic action. That is when there is a blood clot in the heart, blood clot is fibrin clot. No? So to break that, they give this streptokinase. That was isolated from a bacteria called Streptococci. Specifically, we are telling it is group C beta hemolytic streptococci. So isolated this chemical streptokinase from streptococci. It is applied as a lyophilized white powder containing 25 milligram porcelain. So streptokinase is given to dissolve the blood clot. Simple language. Blood clot එක heart එකේ ඇදිච්ච දීවල යන්න දෙන්න. This is drugs interacting with warfarin. Okay. Thank you.